It's a very efficient and smooth process.
Do well in high school and be motivated to study.
I really feel like I'm going to have a lot of opportunities.
They gain the hands-on skills that are necessary to work with patients every single day.
Really getting students focused on what they want to do. They aren't just taking general classes, they're taking specific classes that are going to get them to where they want to be, and they have a great career waiting for them at the end.
The opportunity for this particular profession is growing every day. They almost can't fill jobs that are out there.
They're not only doing their classroom work here and their lab work, they have to go out into the community and meet with the partners and actually do the work with the people that are doing it out there in the real world.
As our population ages, as chronic diseases become worse and worse, we really need more and more, not just CNAs, but nurses who really have a passion for this kind of field.
When they get out, they can go directly into the operating room and just work as a surgical technologist. Tools and instruments and supplies that they would actually use in the OR. It is complete replication of what the OR is.
There's so much to learn in those programs, and if you can get started in them earlier and start beginning to get more familiar with the concepts, it makes it a lot easier.
You are learning invaluable communication skills and time management and critical thinking and skills that are going to last you a lifetime.
The students come out of here feeling accomplished and confident.
That's what this college is about, is transforming lives. It changes their lives forever. They go on to give back to the community, to give great care to patients in the area.
You can start working right away, you can start making excellent money right away, your school debt isn't as high, but then if you do choose to go on with your education, then it's nice that you're working for somebody who could also possibly help them pay for further tuition.
Then there's obviously more growth into the nursing, or they could go on and become a physician's assistant, and even more so, there are ones that grow into become doctors. They just love the field, love the differences they're making, and it's really very rarely a stopping point. Most people keep growing.
We're giving them a foundation for their education and a foundation to get that first job, and then they have opportunities for the rest of their life.
There are so many career opportunities available. Aside from just working in a private practice, you can work in public health, you can work in a community clinic, a hospital, you can travel to other countries. The possibilities are really endless.
Gain high school credit and college credit at the same time. So essentially, they are completing their high school diploma while beginning their college degree. It also makes things more engaging for the students, and it inspires them to really want to carry on with their education or a specific career field.
Our success rate as far as graduation, finding employment, staying within the field, and the flexibility of these allied health careers. You can work 1 day a week or 5 days a week and still make a decent wage. The return on the investment is stellar.
It is hard work, so it requires a lot of dedication, passion, but the end result is well worth it.